Hey everyone, Dr. Charlie Johnson, physical therapist and back pain specialist. In today's video, I want to talk a little bit about how I help people who are having lower back stiffness and problems, specifically when sitting or driving. Nowadays, we're working more than ever, we're sitting more than ever, and traffic is getting worse, in case nobody's noticed around here in southeastern PA. So we're sitting and taking longer commutes in the car. So before I share how I sort of coach people and walk people through this and some specific tips that one could utilize, for anybody who's looking for natural relief, call 484-552-3767. I help people get back to normal without pills, injections, or surgery. Now, we see a lot of times the problem with sitting and driving is that it puts the lower back in a rounded position. So zoom in here, here's my seat, here's the person sitting there, and if we zoom in at the level of the lower back, we see that the bones in the lower back kind of end up rounded. And, well, there's structures in here, specifically like disc, that has fluid inside. We can see that it can increase pressure towards the back of the spine, and structures in the back of the spine can become irritating. Something about the back doesn't like that specific movement because it causes us discomfort. And then what we see, another complaint, is that when people are sitting for a while, they can't stand up very quickly because it's very stiff, and it causes them to feel like they can't stand up tall. They're sort of stuck, and they walk hunched over until they eventually can straighten on up. So this transitional movement is a problem. So I want to talk about a couple strategies that I generally recommend for people who are having this issue. So the first thing is, if the back's sensitive to being rounded for whatever reason, then we want to temporarily modify that. So the first option is we could use a towel roll. Towel roll. And I think I got a towel roll here. Here's one. So I've got a towel. Take a towel a little bit bigger than this. And what you're going to do is you're going to fold it in half. Now ideally it's a little bit wider than this, but just for the sake of showing it here, and we can put like a bungee cord or even a belt here and flop it over top of it and roll it really tight. So that when you roll it up, it's about 3 to 4 inches in diameter, probably even a little bit bigger than this and a little bit wider than this would be more ideal. Put some painter's tape, duct tape, and then, again, the purpose of the belt or bungee cord or whatever going through the middle is that it can be strapped around a car seat so you don't lose it and it goes nowhere. Now, with that being said, how could we use something like this to prevent the back from going into this position? Well, what we could do is we could wrong marker. Put it right back here. So notice we shove it right on the level of the belt in the lower back. Then it kind of creates a little support such that your back is unable to round. So how do we place it properly? A lot of people just sit a back support there and then sit onto it, which doesn't really help. Instead, what we want to do is we want to shove the bottom in the crook of the seat, and then hinge forward and shove this sucker right on the belt line so when we sit up, it's kind of pushing into our lower back and providing some support there. Now, one issue I want to talk about is that might be helpful, and if it is, cool. If it's not, the other option is to use a wedge. And notice in this example, the level of the hips, especially in sort of a bucket seat scenario, the level of the knee is higher than that of the hip. So what we see is that this causes the back to more easily go into a rounded position. So how can we do that? Well, we've got to get the knee lower than the level of the hip. So what we could do is we could just drop the front of the seat down. So then we're in a better position. Or if that's not an option, and we still got the bucket seat, we could build it up. And we could sit on a wedge, such that now you can see the knee is lower than the level of the hip, and what people often find is it's much easier to keep the back in an upright position. So there's two options there. Now really, the best way to do this, and the ultimate way to find relief, is to combine this with what I call a micro stretch. So again, people often have trouble with this transition. So micro stretch number one, which is a short, efficient, quick movement to give people relief, is that before going from a sitting to standing position where they would normally expect a lot of stiffness, just while sitting or even at work, I recommend they just go and they sit up super tall for just about 5 seconds, then relax. Super tall, a little arch in the lower back, and then relax, and then go to stand. So we'll just say up tall, a little correction there with the posture, before standing. And then the second thing is once standing, then I recommend they take their hands and they put them on their hips like this, and they push the hips forward and arch the lower back gently. And they do this for about 10 reps, the back bends, 10 reps, every hour to 2 hours. And this before standing. So again, people who have back stiffness and discomfort often don't like to sit or drive for long periods. The idea and the concept is that something in the spine is sensitive to the spine being rounded. So education-wise, we can use a towel roll, or we can use a wedge to just put the body in a better position so it doesn't end up here, and it ends up more like this. So therefore, we don't have the stiffness while going from a sitting to standing position. And then we can combine that with movement using what I call a micro stretch. Quick stretch, first up tall kind of correction to reduce stiffness while going from sitting to standing, and then repeated back bends every 1 to 2 hours throughout the day to relieve stiffness. So for anybody who found this helpful, like, comment, or share, please. And or for anybody looking to get back to normal, call 484-552-3767. Thanks.